Problem gamblers rarely ever come to treatment only with gambling problems. The vast majority of pathological gamblers have either a history or current mental health or substance abuse issues. We've found in our research that the vast majority of problem gamblers coming into treatment have a history of depression. Often the depression is related to the gambling behaviors, but that's not always the case. We've also found relatively large numbers of problem and pathological gamblers have a history, for example, of suicidal ideation and attempt. And also anxiety disorders, personality disorders like conduct disorder and antisocial personality disorder, and also substance use disorders. We've found that the majority of problem and pathological gamblers coming into our treatment and research studies either have a history of alcohol or substance abuse or dependence or are currently abusing a substance. This is extremely important as far as understanding what you should assess when you first start to see a pathological gambler in treatment, because although the gambling may be primary, there may be a number of other problems that are sort of feeding into the problem of gambling amongst this group. Let me back that one up. So what this means essentially is when you start to treat problem gamblers, you should do a full assessment of psychiatric and substance use disorders, whether it's a history of substance use disorders or current substance use disorders. The problem gambling may be primary, but you might also find that there are current substance use issues or current psychiatric issues that continue to drive the gambling behavior. For example, we see a lot of problem gamblers who are very depressed, either depressed in their own right or because of their gambling, and that depression continues to drive their gambling because they gamble to forget about the fact that they're depressed. Substance use, same thing. Some people will gamble while they smoke cigarettes, for example, while they use pain medications, or while they use stimulants like cocaine. It's extremely important to understand how these behaviors are interrelated.